Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to be discussing the topic of, hey doc, what's dental tourism? So, we hear all sorts of stories as docs about folks who decide that maybe we're a little bit overpriced and they want to go somewhere else to have their dentistry done. They go to a lot of different places. I've recently seen Turkey as a popular destination, but Mexico and some parts of South America, Croatia, those have all been named as places where people go to try to get somewhat less expensive dentistry. They try to be frugal. Well, I'm going to explain to you the results that myself and 3 or 4 other colleagues and I have noticed. That way you all can become more aware of what dental tourism results really are. So in our experience, when we all discussed the topic and what the success versus failure rate was of the different things done in other countries, the success rate is 20 to 30%. The failure rate's about 70 to 80%. So you are taking an enormous gamble by going somewhere to another country where the standards aren't nearly as strict as ours and doing especially big ticket item dentistry. So if you go somewhere and you have a whole bunch of implants done and things start to fail, that's going to be a huge problem because a lot of dentists here in the United States will look at these failing things and say, well, return to sender, go back to your original practitioner who did this and have them fix it. So now you're going on another long trip, spending even more money, only to have somebody try to fix things that they totally screwed up before. And yeah, it's not a pretty picture. So I hope this is getting through to people who are thinking that dental tourism is smart. Most of the time, it actually isn't. So that said, what have some of my results been? That is, what are some of the things that I've seen? Well, I saw this nice old gentleman, and I was even willing to work with him by cutting him breaks on certain things, certain restorative things, maybe charging him 25 to 30% less on a bunch of things. And our fees, quite frankly, are low for our area. So I was really even being super generous. But he decided to go to Mexico. And now he's going to lose at least 2 teeth, if not more. He had at least 1 root canal done that the tooth had no reason to have a root canal. Multiple crowns, all of them look like UFOs. Had a bridge done, 1 of the teeth is now failing, or actually failed and was extracted. So again, not such a good look, not a smart move. Other one, there's a young lady who was proud of her Thai dentistry. Yes, Thailand, great food, don't get me wrong. And there are some good places in Thailand. A friend of mine works there sometimes. He's a traveling dentist, and he says that there are some high quality places. So I'm not gonna lie, there's some good quality stuff there. However, she was bragging about this crown that she had done at such an inexpensive price, and the x-ray, quite frankly, showed it to be made of a resin or plastic material. It was not porcelain. So I kindly pointed that out. I'm like, yeah, okay, it's kind of bulbous, it's a little bit round. It's great that it was cheap, but it's not actually porcelain, it's plastic. So, you paid a cheap price for a relatively cheap crown. Okay, fair enough. You paid a small couple $100 for something that here would have been a couple $100, even trade. So, okay, that was the Thai dental experience that I saw. Well, and recently I saw a bridge that was done, and here is a picture of said bridge that was done with the patient complaining of pain on the tooth that is what we call the abutment or the anchor for the bridge. And of course he said it was loose, where, it's a bridge, but it's attached to 1 tooth, but not the other tooth. Yeah, and so it's all failing. The tooth that it's attached to, the abutment, needs to be extracted. And so now he's lost his ability basically to chew on that side, almost entirely. So again, that's called the Dominican Republic. That's where it was done, Dominican Republic. So those are things that can happen. Now, I do understand we have some patients that say, oh, I went to a very qualified place. They had all these certificates on the walls. Yeah, not that hard to print out certificates. As you can see, there's this practice that I'm showing that has these certificates on the walls. You can see them. And upon closer inspection, they are actually Navy Knowledge Online Certificate of Completion of Course certificates. So They means that somebody went and did a continuing education course on Navy topics and decided to put them in a frame so that it looks good in the office. So, I mean, people can put all sorts of stuff in frames and it can look good, but if you don't know what they are, it could be a janitorial certificate or something like that. It may have nothing to do with dentistry whatsoever. So that said, when it comes to dental tourism, make sure if you're gonna do it, you know that it's extremely reputable and that has done good work in the past. That's the only thing I can say. Yes, sure. Can there be bad work done in the United States? Can our things fail? Yes, we always try. We're in practice. We are trying to do our absolute best all the time. That is how I approach it. I want my absolute best to be done for all of my patients. Will I be a success 100% of the time? No. Will I always try to be? Yes. Will I always do my absolute best? Yes. Because that's what matters most. I want to do my best. I want my patients to be healthy. That's the most important thing. No matter what they choose to do, my patient's health is the most important thing. So that said, good things can be done here and not so good things can be done here in the United States. But the chances of having more success here in the United States is greater than my experience with folks who have gone abroad to try to do their dentistry abroad, because it sometimes saves them some money. Unless something goes really wrong and then they have to have a lot of stuff redone and it doesn't save them anything. So thanks for joining me. Hope you're all staying well and healthy.